In our last video, we talked a fair amount about kidney and its structural and functional unit known as nephron. I want to shift our focus onto the rest of the urinary system for this video. Let's start by looking at urine a little bit. Urine is mainly water, only about 5% of it is solutes. And the largest solute component is the urea. It results from the breakdown process of amino acids. We also find uric acid as a solute. This results from nucleic acid metabolism. And the third one that I want to mention is creatine, which is the metabolite of creatine phosphate. Of course, there are a lot of other solutes which I have provided to you as a list here. The pH of urine is normally about 6.0, and of course, we can sometimes have more diluted and sometimes more concentrated urine, depending on certain factors. What is probably quite interesting and definitely important for us is to consider what should not be in the urine. If we find abnormally high concentrations of any component, well, that would be a concern. Also, there are certain components that there should not be, such as blood proteins, white blood cells, and bile pigments. The presence of any of these may indicate a pathology. Now, we have already looked at the kidneys in detail, so let's tackle the rest of the structures of the urinary system. Let's talk about the ureters. These are about 25 centimeters long that convey the urine from the kidneys to the urinary bladder. And they begin at the level of the second lumbar vertebra, L2, as a continuation of the renal pelvis, which we saw earlier in the last lecture video. In terms of the position of the ureters, these are retroperitoneal, so behind the peritoneum. And once they reach the urinary bladder, they enter it through the base, at the posterior wall. And I have mentioned that they are there preventing backflow of urine as one of its important jobs. This is possible through a mechanism where, when the bladder pressure increases, the distal ends of the ureters close here. One interesting point to make is that the walls of the ureters contain smooth muscle. So again, we can have peristalsis movement, which we became familiar with earlier within our course. I will add a link to the end of this video if you missed it. So this is how we are able to have urinary system working and urinate even in space. Now, next is urinary bladder. So, bladder is a hollow muscular sac that is meant to be a temporary storage for the urine. It stretches as it fills and then shrinks when it empties. In terms of its location, urinary bladder is retroperitoneal. It lies on the pelvic floor, posterior to the pubic symphysis. The other thing that I want to talk about here is the openings that we have at the base of the urinary bladder. These make up an area called trigone. This comes from the triangular shape left between the three openings. Posteriorly, two ureters, marked on yellow on this diagram. And anteriorly, urethra, marked with blue on this diagram. And finally, the last thing for me to mention is the fact that we can end up with infections on this region. And we will see why soon. Now we are ready to look at the urethra. So this is a muscular tube that drains the urinary bladder. There are two sphincters that I want to mention, internal and external urethral sphincter. While internal is involuntary and located at the bladder-urethra junction, the external is voluntary, surrounding urethra as it passes through the pelvic floor. Now, let's quickly consider some differences between males and females in terms of their urethra. Well, we see that it is much shorter in females, about 4 centimeters, while in males, something like 17 to 19.5 centimeters on average. And also note that in female system, the reproductive and urinary tracts are completely separate, while in males, this part is shared by these two systems. And one thing that is a consequence of the differences in the lengths of urethra is that females are at the greater risk of UTIs due to this short distance. There is one more concept that I want to mention just shortly as a term that you should know. Microtition refers to, of course, urination. And if you are interested in more detail of this process, I would recommend you looking at your textbook for further details. And this is where we will finish this chapter. Thanks for joining me on this review of the urinary system.